Do you know what is ECG? How to interpret the ECGs? What do you mean by PQRST waves? So today's video is about basics of ECG. Hello everyone, welcome to the channel Nursing Guru. You're watching Nursing Guru with Jabba Singh. ECG. So ECG is the electrical activity of a heart is being monitored and with a graphical representative. So that is why it is called as electrocardiogram or electrocardiograph. So it is a recording of a waveform reflection of the heart electrical activity. Next, the electrocardiogram is a graphical representative of the electrical impulses that is generated by depolarization and repolarization. Depolarization, the polarization has been happening, so I don't want to go more further in that. Let's consider it as like contraction, some sort of contraction it's like happening, and repolarization means it is like relaxation, so the cardiac muscle get relaxed. So just in common term I'm just explaining that it's a contraction and relaxations. Okay, I'm not going to go more deeper in that ions classifications and what will happen in the ions of polarization, what is the threshold frequencies, like what will happen, those things all we'll discuss in upcoming sessions. So today's sessions we will be reading only the basics of ECG. Before interpreting ECG, let's discuss the conductive system of heart. So in conductive system of heart, hope you all will be knowing, heart is made up of 4 chambers. Okay, so there are right atrium and the right ventricles, the left atriums and left ventricles. There are 4 chambers. In 4 chambers, from the blood from right atrium, it passes towards your right ventricles and it goes towards your lung for purifications, and again it comes as an oxygenated blood to a left atrium and it passes to your left ventricle, and through aorta it passes towards your body. So this is the normal circulatory process. In this, the conductive system, what happens? Let me discuss. Your heart impulses, the electrical impulses starts in SA node. So from SA node, the impulses, some of the impulses is carried also towards your arteries in your left atrium. Okay. The impulses, it goes towards AV node. And from AV node, again, some of the impulses it carries to the bundle of hairs. So this area is called as bundle of hairs, and from here it passes through a left bundle branches and right bundle branches. Okay, so through here it's like Purkinje fibers, and finally it is passes towards the Purkinje fibers. This is the conductive system of your heart. First, the impulses is carried out from the SA node, that is sinoatrial node. Then it passes through its AV node, that is atrioventricular node, and it passes towards your bundle of hairs, left bundle branches, right bundle branches. Finally, it reaches the Purkinje fibers. So the impulses is carried out in these categories. What happens during impulses? So when the impulses, each impulse is like carried out, those time there is a contraction occurs in your heart. When the impulses is carried out in your SA node, what happens? There is a contraction takes place in the atrium. So that is resembled by a symbol called P. Okay, so this wave is called as P wave, which when the atrial contraction occurs. Okay, next is QRS. Now let's discuss regarding the waves of ECG. Okay, so you have P, Q, R, S, T wave. Okay, so this will be your ECG wave. So it consists of P, Q, R, S, T. It stands for P and Q, R, S, and T. In P, what happens? The sinoatrial contraction occurs. So atrial contraction occurs in P. Whenever there is an atrial contraction, it is represented by P. QRS complex. So this one, ventricular contraction. and T represent the ventricular relaxation. So we can also say it as depolarization and repolarization. So P, atrial depolarization occurs, it is represented by P wave. Can you able to see this? Yes, hope you can able to see this. When QRS complex, that is your ventricular repolarization. So electrical conductivity of art is being represented in a graphical representation. So it works in the principle of galvanometer. I don't want to go more deeper in this. Let's discuss in upcoming classes regarding it. Electrical conductivity. So it will be represented by PQRST format. So I'll just draw you how PQRST looks. So it is a waveform like this. So P, Q, R, S, T. So there is P, Q, R, S, T. P stands for atrial depolarization. When atrial is contracting, that movement, if it is left atrium or right atrium. So when the atrium is contracting, it is called as depolarization. So it is represented by P. QRS, it is a complex. So what happens? Ventricular depolarization occurs, the QRS complex arises. T represent ventricular repolarization. Okay, remember one thing, every depolarization is being followed by repolarization. So when P wave contracts, that is depolarized, so what happens? It should be contracting with, the depolarization of QRS complex, that is the ventricles is getting contracted, I told you. So it occurs in QRS complex. And T, I told you, ventricular relaxation. Where is atrial repolarization? For every depolarization, it's been followed by repolarization. When P wave contracts, that is your atrium is contracting, what happens? It should get repolarized and QRS complex, that is a ventricle is getting contract. So when ventricle is contracting, it is followed by, it represent T wave, that is a ventricular repolarization, I told you. Where is atrial repolarization? As I told you, repolarization is followed by depolarization. All the ventricular repolarization, as I told you, depolarization is followed by repolarization. The P wave contracts, okay, and relaxes. QRS complex, I told you, it's ventricular contraction, and T wave, I told you, ventricular relaxation. Where is atrial relaxation? So atrial relaxation, it also occurs every repolarization of the atrium. It is then only it can followed by the ventricular depolarization. It is also present here in a form of wave, but it is masked by ventricular depolarization. Since the ventricular impulses, the electrical impulses in the ventricle, the joules are more, so what happens? The ventricular impulses takes place more when compared with the atrial impulses. So that is why the P wave is bigger in size. P represent atrial contraction, QRS represent ventricular contraction, T represent ventricular relaxation. But atrial relaxation, what happening? It is getting masked inside it. It is getting masked inside the QRS complex. That is why it is called as QRS complex. So QRS complex, it is having arterial relaxation, repolarization, which is hidden behind, since the joules are very less, so it is hidden behind the QRS complex of ventricular depolarization. That is the contraction of your ventricles, because the impulses is more in ventricles. Okay, so this is your electrical impulses. To interpret ECG, as I told you, it is represented by a waveform. So there are different wave P, Q, R, S, T. So in this, so few things you should be knowing. The first thing is called as P wave. So P wave represent the atrial contraction. This is called as PR interval. This one is called as PR segment. This is called as QRS complex, and this one is called as ST segment. And from Q to T, that is called as QR interval. So this is the total contraction and repolarization of your heart, the total depolarization and repolarization of your heart. So what happens if there is any changes in your P wave, that indicates your atrium is not contracting properly. Okay, if any changes in PR segment, that is, or PR in between P and QRS complex, if there is any changes, that indicated the electrical impulses from SA node to AV node is not being carried out properly. And impulses, if any changes had happened in the waveform in QRS complex, that means there is some ventricular complications. If any changes happen in T wave, that is called as repolarization, the ventricular repolarization. There is some problem in ventricular repolarization. So this is the PQRST wave. To interpret ECG, you should be knowing few things. Hope you all might be seeing the ECG. It will be written in some of the graphs. There are some lines and there are some tabular column. There are some graph. Okay, in the graph you can see there are small boxes to interpret ECG. So what happens in your graph, you can see there are a big box consists of 5 small boxes. This side vector is called as time. This is the millivolt or joules, how much electrical impulses is carried out, will be represented in the horizontal, and in vertical the time. If you take one small box, the time travels for an ECG, the electrical wave, the impulses is 0.04 second. Okay, so the one small box is followed by 4 small boxes. So total 5 small boxes are present. One big boxes. So 0.04 into 5, if you put, you will get 0.20 second. So one big box, it consists of 0.20 seconds of energy can be carried out. Horizontal box, 0.1 millivolt. Okay, so 1 millivolt, 0.1 millivolt is carried out in one horizontal boxes. Okay, if you see in the waveform. So I'll just discuss regarding the PQRST format. So I'll just discuss regarding the PR segments and intervals. P, so it takes around PR interval, it takes around 0.12 to 0.20 seconds. Okay, the electrical impulses is carried from 0.12 to 0.20 seconds. And QT intervals, that is from Q to T, so it costs around, so it will be around 0.3 to 0.4 seconds. And from QRS, this QRS, can you able to see this QRS? So this one, it will be from 0.6 to 0.10 seconds. It is the time travel of an electrical impulses takes place in your heart. So one graphical representative of PQRST, P wave, it is 0, PQRST. In that PR, that is 0.12 to 0.20 second for that impulses carried out in P. On QRS complex, it is 0.6 to 0.10 seconds in the QRS complex. And the total QT ventricular contraction, it takes place 0.3 to 0.4 second. So this is your electrical impulses in your heart. To interpret the ECG, you should know few things. So what are the things you should be knowing is what type of ECG it is, whether it is 12 lead ECG. Okay, so that you should be knowing. And second one is rate, rhythm, and what axis it's been taken. Okay, so these all we'll be discussing in the next upcoming sessions. Rate, what is the rate of the ECG? I mean, what is the pulse rate, your heart rate, which has been carried out from every QRS. The RR interval can be checked to find out the rate. And the next one is rhythm. How to check the rhythm is from RR. If the regular rhythm, it will be same timing, it will be like forming. Can you able to see this? The rhythm will be so regular from one RR interval to another RR intervals. Okay. Next, you have to go with P wave. If P wave is present, and how the P wave, the waveform, whether it is inverted or normal. So according to that, if the P wave is normal, it will be around 0.1 to 0.20 seconds. So this one. And QRS complex. So QRS complex, next you'll be checking regarding the QRS complex. So QRS complex tells regarding your ventricular contraction, and QT segment tells regarding the ventricular relaxations. So I mean, from contraction to the relaxation, so how much it takes. So these all will be found in the ECG patterns. And T, so how much time it takes for contraction to takes place. So that will be represented in T. So that's it about the basics of ECG. That first you have to go with the rhythm. So how to find out the rhythm? The first one is you have to take how to find out the heart rate. So 1500 by number of small quairs in one RR interval. So from one RR to the next RR, how much is the interval? So that can be observed in 1500. That should be divided by 1500. When you do that, you'll get an answer. So that is the rate of a heart. Or else 300 divided by number of big boxes. So when you calculate number of big boxes between an interval, in that if you divide 300, so you'll get an answer of your heart rate. And rhythm, to check whether it is normal sinus rhythm, so the RR intervals, so you'll be checking it out. And P wave, how much is the P wave, you'll be like finding out what is the seconds duration. Next, PR interval, you'll be like finding out. QRS complex, you'll be like finding out. ST segment, T segment, and QT segment. So these all, when you are finding it out, you can find out the electrical impulses which is carried out in your heart. So far we discussed regarding what is ECG and the basic how to interpret it. So like how to make the rate, rhythm, and what is PQRST. So these all we discussed, like PQRST, what the P wave stands for, what is the QRS, what is ST, what is QT. So these all we've discussed at present. Okay, in upcoming session we'll be going deeper in ECGs, like what is the intervalence triangles, like what are the axes in the interval section. So everything we'll discuss in our next sessions. Until then, stay tuned. See you all in the next classes. Bye.